Hi Mr. Brown, my name's Kieran Ross, I'm one of the student physical therapists. Today I was hoping to do some exercises and some treatment with you if that's okay.
Sounds good.
I was hoping to get you up and moving so we can try and improve your lower limb strength and your balance, which would then help with your independence and then your movement and your own as well.
Lovely.
Okay, yeah?
Yeah, all good.
Cool. So in a little second I'm going to get you standing up, and the first thing I'm going to do is we're going to do some weight transfers where we're leaning from our right leg, then going onto our left leg, just like that.
Okay.
Just holding for a little second or two and just thinking about taking a bit of the weight side by side, just to kind of help you get used to kind of supporting your leg on a single leg.
Yeah,
if that makes sense. Or supporting your weight on a single leg rather.
Yeah.
Sorry, perfect, cool. From there, I'm just going to get you turned towards the plinth, and we're going to do some side steps. So we're just going to do little steps towards the side, and then bringing our foot over, and then the same again, just like that.
Okay.
Cool. And if you're happy enough with that, and you're not too fatigued, I'm going to get you doing a little bit of practice of bending your knee and your hip, just so we can try and improve that kind of specific movement of your walking, because I can see right now it's probably one thing that we're struggling with.
Cool.
Okay.
Sounds good.
Cool. Are you happy enough with all that, sir? Yeah?
All good.
Yeah, cool. Are you happy enough for me just to touch you today as well, if that's okay, just so I can make sure that I can support you best as possible?
Yeah, perfect.
Okay, cool. No problem. Right, I'm just going to have a hand on your shoulder and then a hand on your hip, if that's okay, and then we're going to sit up in a little second. So I'm going to get you to try and push through your legs, and we're going to use a little bit of forward lean. So in 3, 2, and then 1. Perfect, just standing up. Cool, no problem at all. Okay, just initially, I'm just going to get you to do the weight shifts. Yeah. So first, you're going to move towards me. You're going to try and bring your hip towards mine almost. So if you lean towards there, perfect, good, on your left leg, and then leaning towards your right, just like that. Good. Then same again, leaning towards your left, good, and then over to the opposite side there. Good. And same again. Is that all okay?
Yeah, perfect.
Yeah, okay, cool. So we could go for a specific duration of time, but today, just for technique wise, we're just going to show you that. We could increase the duration depending on your fatigue levels. Okay, we're just going to take a little step towards the table now, if that's okay, so you can shuffle around. Yeah, that's okay, perfect, cool. Happy enough there? All good, yeah? Yeah, cool. So now we're going to do the side steps. I'm going to get you first just to think about taking a little step, and you're going to try and lead towards my leg, if that's okay. Good, yeah, nice, perfect. And same again, really try to pick your toes off the floor, lifting your legs up, good, nice. And one more step, try to bring your leg up, good, nice. Okay, we're going to do the exact same over to the opposite side now, just with your left leg this time, just try and bring it towards the kind of middle of your body, if that's okay. So step over with the right, and then bring your left leg in, perfect. Step over with the right, and then bring your left leg in. One more, step over with your left leg. Okay, cool, no problem. Are you happy enough? All good, yeah? Cool. So I'm just going to get you turned around so we can go back to that starting position here then, okay? Yeah. Cool. Do you want to just use a little bit of support with the plinth just now, if that's okay? Yeah. So just use as much as you need, okay? I'm just going to get you now to do a little bit of kind of technique work where we're really going to think about picking a knee up and bending a leg as much as possible, if that's okay. So I'm just going to support the back of your knee initially and then use your foot as well. And I'm going to get you just to try and bend your knee as much as you can, okay? So just initially we're going to just do a rep ourselves as well. So just keep your right leg planted if you can. Yeah, perfect, good. And we're just really going to think about bringing that up, planting, good. And then we're going to do the same back, lifting the knee up, bending the leg, good. Nice. Same again, big step, and then plant, good. And then bend your knee, bend your hip, good. Perfect. Right, you want to just do a couple more reps, and we'll just get you to look at the mirror as well, if that's okay. So really try and bend your knee up as high as you can, and then plant, good. And then same again, good, and back, nice. I'm just going to take a hand off because I think you can manage that on your own, and I'm just going to give you like a little bit of stimulus here, just so you think about using these muscles at the front of your leg. Okay, so just pick your knee up again, bend your hip, and then bring it back again. Bend your knee, bend your hip, and back. Really good, nice, perfect. Cool, so I'm just going to get you to take a little seat again if that's okay, so just have a little look first, and then we're going to bring your hips back, bend your legs, sitting down. Okay, cool. Yeah, I was happy with that initially. Obviously, just in terms of like intensity, I would kind of get a bit of communication from you, just to make sure that you're not doing too much at once, and it was the appropriate kind of intensity for you just initially. We could scale this up and then progress this as well. For progressions, we could use the kind of side step and increase the distance, or we can increase the times and the amount of reps that we're doing as well. In order to kind of make it a little bit easier if we need to, say you were really fatigued and you were really struggling, we could do smaller steps, or we could do less time as well. Yeah? That sounds good, perfect, cool. Are you happy enough with all that?
I'm happy enough, yeah.
Is that okay?
That
cool.
sounds good.
If we wanted to kind of advance it further on as we're kind of getting down the line as well, we could kind of incorporate a little bit more, even a step to a box or a step over a cone to try and get a little bit of ground clearance as well, which I think is quite important. And yeah, that's perfect. Yeah, cool. No problem at all.
Thank you very much.